Hi everyone, welcome back again to my channel. My name is ROSELYN. I'm a clinical nurse, and in today's video I'm going to present a topic on hypercalcemia. I'm going to talk about the signs and symptoms, the causes of hypercalcemia, and how to manage it. So stay tuned. Hypercalcemia is a condition in which you have too high concentration of calcium in your blood. Calcium is essential for the normal function of organs, cells, muscles, and nerves. It's also important in blood clotting and bone health. However, too much of calcium can cause problems because hypercalcemia makes it hard for the body to carry out its normal functions. Extremely high levels of calcium can be also life-threatening. Sometimes you might not have noticeable symptoms when the hypercalcemia is mild. And if you have more serious case, that is when the hypercalcemia is severe, of course you'll experience some typical signs and symptoms that can affect various parts of your body. And these signs and symptoms include headache, fatigue, some kidney-related symptoms like excessive dust, excessive urination, pain between your back and abdomen on one side due to kidney stones. Some abdominal symptoms can also occur, which include nausea, abdominal pain, decreased appetite, constipation, vomiting, and we also have heart-related symptoms because high calcium can affect the electrical system of the heart, causing abnormal heart rhythm. The muscles are also affected when there's hypercalcemia, and you might experience symptoms like muscle twitches, cramps, and weakness. Your bones or the skeletal systems can also be affected when you have high calcium, and this can lead to bone pain, it can lead to osteoporosis, and fractures from hypercalcemia. Neurological symptoms can also happen. You can experience symptoms such as depression, memory loss, and irritability. And in severe cases, confusion and coma can occur. So patients with known cancer and they experience symptoms of hypercalcemia, it's necessary for them to consult their doctor immediately because it's not uncommon for cancer to cause high calcium levels. So when this happens, it's usually a medical emergency. Your body uses the interaction between calcium, vitamin D, and parathyroid hormone, which is also called PTH, to regulate calcium levels in the blood. So your parathyroid hormone helps the body control how much calcium comes into the bloodstream from the intestines, kidneys, and bones. And normally, the PTH increases when the calcium levels in your blood falls and decreases when your calcium levels rises. So your body can also make calcitonin from the thyroid gland when your calcium levels get too high. When you have hypercalcemia, there's excess calcium in your bloodstream and your body can't regulate your calcium level naturally or in a normal way. So there are several possible causes of this condition, that is hypercalcemia, and one is hyperparathyroidism. So the parathyroid glands are 4 small glands located behind the thyroid gland in the neck, and they control the production of the parathyroid hormone, which in turn regulates calcium in the blood. So hyperparathyroidism occurs when one or more of your parathyroid glands becomes overactive and releases too much parathyroid hormone. So this creates a calcium imbalance that the body cannot correct on its own. And this is a leading cause of hypercalcemia, especially in women over 50 years. Another cause of hypercalcemia is lung disease and cancers. So granulomatous diseases such as tuberculosis and sarcoidosis are lung diseases that can cause your vitamin D levels to rise. This causes more calcium absorption, which increases the calcium level in your blood. Some cancers, especially lung cancer, breast cancer, and blood cancer, can also raise your risk for hypercalcemia. Medication side effects is another cause of hypercalcemia. Some medications, particularly diuretics, can produce hypercalcemia. They do this by causing severe fluid diuresis, which is a loss of body water and an undersecretion of calcium. This leads to excess concentration of calcium in the blood. Other drugs such as lithium cause more PTH to be released. Dietary supplements and over-the-counter medication can also cause hypercalcemia. Taking too much vitamin D or calcium in form of supplements can raise your calcium levels. Excessive use of calcium carbonate found in common antacids like Tums can also lead to high calcium levels. High doses of these over-the-counter products are the third most common cause of hypercalcemia. Dehydration can also cause hypercalcemia. This usually leads to mild cases because dehydration causes your calcium levels to rise due to the low amount of fluid in your blood system. However, the severity greatly depends on your kidney function. In people with chronic kidney diseases, the effects of dehydration are greater, so they are likely more to suffer hyperglycemia. The doctor can use blood tests to check the calcium levels in your blood. Urine tests that measure calcium, protein, and other substances can also be helpful. And if you are found to have high calcium levels, more tests can be ordered to find out the real cause of the condition. So blood and urine tests are the major tests that can help in diagnosis of hyperparathyroidism and other conditions. So some other tests can also be recommended to check for evidence of cancer or other diseases that can cause hypercalcemia. And these tests include chest x-rays, which can reveal lung cancer, mammograms, which help diagnose breast cancer, CT scans, which form a more detailed image of your body, MRI scans, which produce detailed image of your body's organs and other structures, DEXA, that's bone mineral density test, which evaluate the bone strength. So there are treatment options for hypercalcemia, and these treatment options depend on the severity of the condition and the underlying cause. So for mild cases, you may not need immediate treatment if you have mild hypercalcemia, and also depending on the cause. However, you will need to monitor your calcium levels and find the underlying cause because it's very important. The effects that elevated calcium levels have on your body relate not just to the level of calcium present, but how quickly it rises. So therefore, it's important to stick to your doctor's recommendations for follow-up. Even mildly elevated levels of calcium can lead to kidney stones and kidney damage over time. So it's good to monitor your calcium levels. Moderate to severe hypercalcemia, this you likely need hospital treatment. That is if you have moderate or severe hypercalcemia. The goal of treatment here is to return your calcium levels to normal. The treatment also aims to prevent damage to your bones and kidneys. And the common treatment that you can get from the hospitals include calcitonin, which is a hormone produced in the thyroid gland and slows down bone loss. You can also be given intravenous fluids to hydrate you and lower calcium levels in the blood. Corticosteroids are anti-inflammatory medications which can also be given in the hospitals. They are useful in the treatment of too much vitamin D. Loop diuretics are another kind of medications that can help your kidneys move fluid and get rid of extra calcium, especially if you have heart failure. Intravenous bisphosphonates is also another treatment which lower blood calcium levels, regulating bone calcium. Dialysis can also be performed to get rid of extra calcium in the blood so that to prevent kidney damage. And this is usually done if the option of other treatment is not working. Primary hyperparathyroidism, which is a cause of hypercalcemia. Depending on your age, kidney function, and bone effects, you might need surgery to remove the abnormal parathyroid glands. This procedure cures most of the cases of hypercalcemia caused by hyperparathyroidism. If surgery isn't an option for you, you may be recommended to take some medication called Sensipar. This lowers your calcium levels by decreasing the parathyroid hormone production. If you have osteoporosis, you may be recommended to take bisphosphonates to lower the risk of fractures. If you have cancer, your doctor will have to discuss the treatment options with you to help determine you the best ways to treat hypercalcemia. You might be able to get relief from symptoms through intravenous fluids and medications like bisphosphonates, and this might make it easier for you to deal with your cancer treatment. The medication sinasalset can also be used to treat high calcium levels due to parathyroid cancer. It has been recommended for hypercalcemia related to cancer conditions. Hypercalcemia can cause kidney problems, such as kidney stones and kidney failure. Other complications include irregular heartbeats and osteoporosis. Hypercalcemia can also cause confusion or dementia, since calcium helps to keep your nervous system functioning properly. Serious cases can lead to potentially life-threatening coma. So in conclusion, how you manage your hypercalcemia will depend on the cause and how severe your condition is. And a doctor is the best person to determine the treatment for you. So it's good to talk to your doctor regularly, to stay informed and ask questions. Be sure to keep up with any recommended follow-up, tests, and appointments. You can also do your part to help protect your kidneys and bones from damage due to hypercalcemia by making healthy lifestyle choices. Make sure you drink plenty of water. This will keep you well hydrated, keep blood levels of calcium down, and decrease your risk of developing kidney stones. And since smoking can speed up bone loss, it's important to quit as soon as possible. Smoking causes many other health issues, so quitting smoking can only help your health. A combination of physical exercises and strength training can keep your bones strong and healthy. So it's good also, you can talk to your doctor first to find out what types of exercises are safe for you. This is especially important if you have cancer that affects your bones. So make sure to follow the guidelines for the doses of over-the-counter supplements and medications to decrease the risk of excessive vitamin D and calcium intake. So thank you for staying tuned. See you in the next one.